Namaste. I welcome you all to the 55th session of Gurubodha. I dedicate this and all of my works at the holy feet of Dr. A. Chandrasekhar Udupa. This class is made live, available for the weekly class subscribers. If you are not subscribed, please go to easyayurveda.com/video-classes. And coming to the questions for today, there is comparison between Murivenna and Dhanwantaram oils.
There are a lot of oils in Ayurveda, but still many a times we find it difficult to select a type of oil in a particular condition, of course. Whereas in these two, Murivenna and Dhanwantaram, very clearly, Murivenna is from the Sahasra Yoga reference, and it is somewhere connected with the Kerala-based treatment aspects in the Kerala Panchakarma, whatever it is. Whereas Dhanwantaram oil or Dhanwantaram Taila has traditionally from the Ayurveda scriptures, and it will be very fine. And it is, of course, one of the important oil which can be used in pregnancy as well as after delivery, and because it's one of the nourishing oil, Dhanwantaram Taila, and it is very typically goes through its in Falashruti. Very clearly, it is mentioned as Sarva Vata Rogajit. It is useful for all sort of Vata Rogas. Of course, it all contents are also typically Vata Hara Dravyas in that itself. Moreover, as an added advantage, it is in the oil format. So definitely this Taila format is very good for the Vata. And definitely this is being used in many conditions of where there is typically Kshaya, a type of thing, or tissue loss or something like that, or maybe due to old age, or due to pregnancy, delivery, and these type of conditions, as well as even in simple painful conditions also, Dhanwantaram Taila can be used. Whereas Murivenna is very typical. The name itself suggests it is used in the fractures. So it's very clearly Muri means there is a fracture. So wherever there is a discontinuity of tissue, definitely Murivenna is of a right choice. It may be any wound or ulcer which is not healing, or it may be any bone fractures which is not healing, or it may be something like some ligamentum tear or ACL tear or something like that, or bursitis or something like that, or even the frozen shoulder, such type of conditions where there is an external injury causing it, and there is a discontinuation of anatomy, and such type of injured areas, Murivenna will be the best to heal up the condition. And of course, definitely both are very good. Once again, it depends on the physician choice and the availability of the medicines to use those conditions. But peculiarly in wound management, as well as where there is a sprain or ligament tear, or is a twisting of the joints or something like that, or any bursitis or such type of conditions where there is an injury, on those areas it is better to use Murivenna. Whereas in other Vata Vikaras, what we call, in that conditions, it is better to use Dhanwantaram Taila.
Yeah. So do you also use Murivenna in non-healing wounds associated with diabetes?
Yes, definitely. I use it Murivenna for particularly in non-healing ulcers, maybe which is due to diabetes, or even it is due to venous insufficiency, or the venous ulcer or varicose ulcers, or such type of things. I have used it, and it gives really a good type of healing.
How to apply? Via Pichu or Dhara? Or
usually I use this Murivenna particularly in ulcers or non-healing wounds or such type of things, usually in the format of warm Dhara. It is the form of Dhara, and it will be warm, and that oil will be recycled and used, and then later it will be filtered, and we use it in when burn injury and all those things. All usually any injury which is discontinued or destroyed the tissues, fractured, torn, or anything like that. In those conditions, definitely Murivenna is a good choice.
And so Dhanwantaram oil is made into Dhanwantaram 101, and its capsules are also available. So it has its oral usage also, sir?
Yes, definitely it has got its, that's what very typically it is used in case of Abhyantara as well as Bahya Roga Margas in both the places. I mean, Bahya Paramarjana purposes as well as Abhyantara purposes. Typically now it is very easily available in the form of soft gelatin capsules as well as hard gelatin capsules, Dhanwantaram 101 or even Dhanwantaram. And typically it is just for the sake of mentioning Avartana has been done. They used the 101. I don't think so. No company is producing any Dhanwantaram 101 time that is Avartana. So it is multiple times they have done Avartana, maybe 7 times or 20 times or 11 times, some 14 times, something like that. So these Avartana, 101, a type of these type of things, are even one Dhanwantaram, multiple Avartanas, Taila are even used for the Nasya purposes in Vata rogas, typically the paralysis or ardhita and such type of conditions, or wherever there is even have used in GV syndrome type of conditions also, this Dhanwantaram 101 can be used and it gives comparatively good results.
If we take Dhanwantaram versus Ksheerabala, it's also used orally versus Gandha Thailam. Can some differentiation be made, sir?
Definitely in case of paralysis or where there is a chalatva hani or something like that with respect to Vata, I prefer Dhanwantaram. Ksheerabala usually in case of where there is a mild Vata type of conditions or it may be like and by Gandha Taila, very typically it is used in Kshayavastha of Asti, where there is a decaying of Asti Dhatu. In those conditions, Gandha Tailam works better. Like osteoarthritis and these conditions, I prefer Gandha Taila over Ksheerabala.
Yeah, so coming to Murivenna and Dhanwantara Taila, I think Gururaja sir has really differentiated many points and he has given an extensive explanation. So Dhanwantaram, I have used Dhanwantaram to successful proportions, especially in back disorders like back pain, lumbago, so even in sciatic pain. So different combinations we use, but extremely useful whenever you think of Dhanwantaram. When you think of Vata or Vata disorders, you can just think of Dhanwantaram. Dhanwantaram can also be used in some conditions where Murivenna is used, but Murivenna is very, very specific for wounds or fractures, maybe sprains like dislocation, arthritis, maybe some even in gouty arthritis. And if we consider Vata Rakta also, it is very good. Murivenna is very good. We have different. Pinda Taila is of course the preferred one, but Murivenna and Pinda Taila, a combination of both in equal proportions can be used in gouty arthritis for Dhara. So whenever we are thinking about sprains and also fractures, wound healing, as you already said. So in these conditions, Murivenna is exclusively used. Dhara will be absolutely fine. Absolutely helpful. Dhanwantaram, again, for Kati Basti, especially in low back aches with various combinations, maybe Ksheerabala or Mahanarayana Taila. So we can prefer our combinations according to our practice and successful formula. So, but Dhanwantaram is definitely preferred. And Dhanwantaram, one more thing is Dhanwantaram Taila for giving Vasti, Matra Vasti or Anvasana Vasti in chronic Vata conditions. So painful conditions of the low back and also the lower limb. Dhanwantaram and Sahacharadi Taila, both these things are extensively used. So that can be used. And Dhanwantaram 101, as you said, again for Vata Vikaras, it is a very good choice. So it is used for internal consumption and also for Nasya. So many people found good relief. Dhanwantaram Taila 101 Nasya for even headaches, not of the sinusitis type of headaches, like moreover a Vata type of headache, like pain, a neurological type of headache we can call it as, and catches and stiffness. There are other preferences also. Dhanwantaram can be used, not as a first choice, but it can definitely be used. But in low back conditions, for Kati Basti, for Basti, all these conditions, Dhanwantaram is an exclusive choice. I wanted to add Vata Rakta in Murivenna. So Pinda Taila being the first choice there.
Coming to a few questions asked, Murivenna for burns.
Definitely, because burns is one of the injury and definitely it can be used. And that's what I said, but it is not as in a very early stages of burns, a fresh burns, it is not used. It is only after for the later stages when a recovery point is required, tissue regrowth requirement starts developing. In that condition, Murivenna helps. But I don't think so when there is a fresh burn on that we use Murivenna. That may not be cooling in that as such because it contains Alandu Bija and all those things are there in that one. That may not be cooling as such.
Yeah, so in terms of using for wound healing and burn healing, I feel Sushruta's Shashti Upakrama will come in handy, where Vrana Upachara has been explained in 60 different processes which go in a chronological way. So where Ama Vrana, Pachamana Vrana and Pakva Vrana, all those things, Sushruta makes a beautiful classification, where in the initial stages, as Gururaja sir said, I would like to add there, Ama is involved, so in this Vranas or in the burns maybe. In such a condition, using Taila would not be appropriate. So it is a methodical approach in Shashti Upakrama. So there is a methodical approach to how to handle these wounds and ulcers and external damages. So that may also include the burns also. So that is caused due to Agni or Kshara, whatever. So in initial conditions, there will be a lot of clay, like the wounds and also the burns will have a lot of moisture. So there will be congestion. So in such a condition, since moisture is there, since clay is there, using Taila for a dara or application may worsen the condition, may increase itching and other symptoms also. In such conditions, it is better to avoid. So get clear, get a clarity of where exactly the disease is. Once the ama has been got rid of, once the wound starts healing in the process of Pachamana, even after it crosses the Pachamana avastha and it comes to the Pakwa avastha. So like when it can be easily handled, free of ama, free of kleda, in such conditions, Taila can be used. Murivenna or any other beneficial oils can be used in those contexts. Shashti Upakrama is the golden guideline for us to handle this.
There is a question on which brands to recommend.
There are plenty of players in the market with good quality things.
So regarding Mahanarayana Taila and Dhanwantaram Taila, in terms of indications and in terms of ingredients, Mahanarayana Taila looks richer compared to Dhanwantaram Taila.
As the clinician part of it concerned is, whenever we have a conditions of these Vata type of things, many a times I have seen the successful Ayurveda practitioners, they don't go with a single oil. They make a combinations. So many a times I have seen people combining Dhanwantharam with Karpuradi Taila for a better pain relief, Dhanwantharam with Mahavishagarbha Taila for avoiding the Sukhi or some numbness or something like that. So like that, there are plenty of combinations can be made. Maybe 2 oils or 3 oils are clubbed together. As an individual oil, if you do concern, Mahanarayana Taila or Balashwagandha Taila or Dhanwantharam Taila, I don't see much difference in their utility. As a part of utility, that all of them are Vatahara, all of them are used in typical conditions like pain, sprain and knee injury or wear and tear or even the Vata Kshaya or osteoarthritis or arthritic conditions like this. So as such, in their utility, I don't find any big difference.
And one more point is doctor's favorite. So some doctors have their favorite medicines, like they're traditionally practicing like Mahanarayana Taila. There are like a fan club of Mahanarayana Taila. So the doctors who love using that Mahanarayana Taila. So doctors who love using Dhanwantaram Taila. So most of the Karnataka doctors I had seen previously using Mahanarayana Taila. Dhanwantaram was so when I was doing my graduation, so I used to see plenty of Mahanarayana Taila used for these painful conditions, Vata conditions. Dhanwantaram, we hardly found Dhanwantaram in our I graduated from Government Ayurvedic College, Ballari. So that is early 90s, from 89 to 5.5 years. So at that time when I used to say, Dhanwantaram was hardly found to be practiced like most doctors. So once popular doctors of that particular college started using Mahanarayana Tailam and started giving results, other doctors, the junior doctors, so it will go like a hierarchy. So like it will just spread through the chain of Guru Shishya Parampara. So our gurus used to use Mahanarayana Taila. Okay, let me use Mahanarayana Taila. So Ishwaridi sir, our Ishwaridi sir, so is no longer there. So he was a great guru of Ayurveda there. He used to use Indukanta Grutam plenty for Snehapana. For so many conditions, he used to use Indukanta Grutam, Gugulu Tikta Grutam. So very favorite for Ishwaridi sir. Indukantam, Gugulu Tiktakam. Indukantam, Gugulu. Nobody even used to reason at that particular time as students because he had a rush of OPD and he did not have time to explain. So that was the thing, and he hardly spent time around the bedside. So later, his students and their students also started using for Snehapana, Indukanta Grutam or Gugulu Tiktaka Grutam. So that went on through the hierarchy. So without reasoning. So this is following the Guru Shishya Parampara and also our favorite medicines. So as long as we are giving results, so it becomes customized. Like the problem comes when that particular medicine doesn't yield result. Like it is a yukti-based practice. Ayurveda is moreover a yukti-based practice. So once we get results in 5, 6, 7, 10 cases, so we are very much used into why to do experimentation on some other oil. So I'll use Mahanarayana Taila is giving good results for me. Somebody else recommends Dhanwantaram to me. No boss, I'm using Mahanarayana Taila. This is my favorite. It has been giving results. When the 11th, 12th and 13th cases fail, then I will think about something else. Why these things failed in similar type of cases. And that time we will start exploring the other options also. So, but as Gururaja sir rightly said, most of these Tailas which have the Vatahara properties are almost similar in action. Maybe a little that side and little this side.
And how do we decide external versus oral intake of the oils? Both Narayanam Tailam, oral intake is mentioned Pana, Abhyangana, Nasya is mentioned, and even with the Dhanwantaram also. So how to decide orally or externally?
See, we need to go for the Falashruti of the every Taila. Our Acharyas are very clearly mentioned in the Taila, whether it is for the Pana, Abhyanga, Snana, Navana, everything like that, they will mention it. So when they said it is Pana, it is Yogya, and for the Pana, definitely it can be taken internally, or it can be used as an Asya, Navana. If it is not mentioned, of course, we need to take care of it. But certain times, very clearly, Acharyas, particularly for example, Dhanwantaram has a very typical affinity towards the Apana Kshetra. Anything which is around the pelvis, Dhanwantaram will definitely give good result. It may be Yoni Roga, it may be related with delivery, or it may be related with even the any avascular necrosis or something like that, hip joint or anything related with those areas, or even sciatica, lumbago, or any other IVDP, all these conditions. Definitely, we can use Dhanwantaram there. And of course, another point is that we need to go through the ingredients of these oils. If any oil do contain some or the other mineral items or Visha Dravyas or something like very Tikshna Dravyas, Ballataka, Vishamusti, Kupilu, or even Vatsanaba, or something like that, or anything such nature, if it is there, then usually it will be for external usage. Acharyas won't describe them to use it internally. So you need to understand with respect to Falashruti, very clearly in Falashruti they are mentioned whether it is Pana, Abhyanga, or only for external purposes or anything like that. Very clearly Acharyas have explained. We need to follow that on. That's all. No need to go for any experimentation in this.
And also like when to use it, probably for the internal thing, like for example in the Kostakata, Vata, etc. That also acts as a criteria to use it internally, sir. This is the Narayana Taila.
See, it's very difficult to make the patient to drink oil. It is not possible. That may be good for those days where Acharyas used to do it. People may to consume. Nowadays, people are even not ready to consume kashayas and even gritas. Now everything we are encapsulating it. So it is not possible for that type of nature. So we need to give them in form of a capsulation. And when it comes to encapsulation, then definitely we have options only regarding to Kshirapala. We have regarding the Dhanwantaram, Gandhataila, or something like that, which is very much popular. They all come in form of encapsulation. Only one company recently from Hyderabad, I think I have come across recently. The company may be there since many years. They have come across, they brought many oils, gritas in the form of Avartita Tailas and all those things in the form of soft gelatin capsules. They have got 7 Avartita, 21 Avartita, something like that. They have got many such type of things. Even Sahacharadi, it is there.
Usage of Dhanwantaram Taila or Kshiravalla Taila or whatever it is there. One is multi-dimensional approach. See, though there is a Vata Vikara, like a neural pain in the lower limb, we may consider, or a low back pain. So that will be associated with the other Vata conditions and also other Vata sthanas. Pakvashaya, Katisaktis, Shrotrastis, Parshanendriyam, Sthanam Vatasya. So specific regions for specific doshas have been mentioned. Here there are so many places and sites in the body where doshas are spread over, and there is one central government which is controlling those things, like Pakvadanam Visheshata. Pakvashaya is the basic control station for all the Vatas. So wherever the Vata Roga is manifesting, so it is one site which is controlling the other sites. So there is a central government and there are other governments which is controlled by the so like Pitta Pradhanasthana is Nabi. So when we are considering this multi-dimensional approach and for a better result, so internal and external therapy. So why our Ayurveda Acharyas have given so many dimensions of usage for particular medicines and not for many others. So like if there is Pana, Nasya, Abhyanga, etc. So that means to tell that we can consider the multi-dimensional approach in that particular condition. So if there is a Vata Vyadhi, I can give either a Snehapana and Abhyanga or Vasti and Abhyanga. Of course, Ubhayataha Snehana, like Snehapana and Vasti cannot be given together. Nasya and Vasti cannot be given together. Apart from that, so we can use at least 2 modules at a time of the same Sneha to add the healing. So internal healing and external healing both are taking place simultaneously. And number 2, depending on the severity of the condition, mild, moderate, severe, wherever aggressive approach is needed, so we will go with the extensive use of that particular Taila or medicine which has been used in multiple modules. Like I will use oral consumption and Abhyanga at some time. After that, I will go with the course of Basti also. So to add to the results of that particular disorder in severe conditions. So number one is multidimensional approach of these things. Anyhow, in Palashruti they have mentioned, and another thing, seeing the condition of the gradient of that particular disease or the symptom, mild, moderate, and severe. So how many things, how many methods, and how many pathways of administration of medicine I need to, so that we can judge according to the practice and according to the experience. We can use more than one, more than two also at different instances and different stages of the disease.
Does Murivenna give good results in diaper rash? So it contains saranja, and then aloe vera is also there.
The diaper rash will have a little bit of irritation, and in those conditions, there will be oozing to some extent. Something which is in the form of drying up nature, or which is in a powdery form, that will be more beneficial. So if you have any dusting powder which can be used in diaper rash, that would be better comparatively, because in market now we have got one dusting powder containing even gandhaka and all those things, which can be used in diaper rash and these things, particularly from the, I think, Vasu company. It is in the form of cuties dusting powder, so it's available. And another one condition is that you can definitely use this oil, but after application of oil, we need to take it off because it won't be totally absorbed, or it can totally evaporate. So that needs to be washed. So only we can use it for some time as a smearing it. But afterward, you need to, and it will definitely stick onto the cloth and all those things. We need to think of all those application. It may be mentioned, but how far it is beneficial in practice. So better thing is that something which is a dusting powder type of thing, that will be better.
Yes, and also coconut oil is the base, so it becomes a little sticky, and then that area is usually, especially in babies, like urine and other things, makes up sweat, etc. So it's not, drying is very necessary, as you rightly said, sir.
Yeah, for diaper rash, again, the same rule applies. So we should see if Kleda is present or not, Ama is present or not there. If it is a wet and damp thing, again, applying the oil, it will worsen the condition, number one. And the Murivenna is, if we need to consider Murivenna and nothing else is available, Murivenna is also available in the form of ointment. Not only Taila, Murivenna is available in the form of ointment. The other option will be Jatyadi Taila or Jatyadi Grutam. So that is also available in the form of ointment, if at all, if it is needed. So that can be used also. And one more thing is, if people can prepare Nalpamaradi, Kashayam is available. So Nalpamaradi Kshira, so like with the Kashaya roots itself, if the milk can be processed with Nalpamara, so Nalpamaradi Kshira. So if that area is bathed with that particular milk, so I think that will give good results. So Panchavalkala can also be used, but Nalpamaradi I found in diaper rash and also in some chronic wounds, maybe chronic wounds and also ulcers. So the Dhara with Nalpamaradi Siddha Kshira. So I think it will give wonderful results. For that, chronic ulcers and also chronic wounds, a Dhara can be done with Murivenna oil initially, and then followed by the Dhara with Nalpamaradi Kshira. So that gives extensively good results. In diaper rash also it can be done. If the parents can sit that baby or the child in a tub which is filled with that oil, that is milk which has been processed with Nalpamara. So I think that will give good results. So later it should be wiped out and dried. That is another thing.
Definitely in the same manner, we have Panchavalkala also available in the form of ointment. So that can also be used definitely in these areas.
Yeah, Panchavalkala Lepam by Univa Medica.
Yes, it is there.
So what are the oils and Abhyanga and Nasya for Pitta dominant persons with epileptic seizures?
Pitta dominant person, definitely Kshirabala will definitely do the wonders. Kshirabala is sufficient.
Yeah. So especially for Vata balance, there is
the balance. That's Kshirabala is definitely went. Then after, along with that, you can go for even to some extent Balashugandha Taila. Balashugandha also gives good result in these conditions.
So, and also, not necessarily for epileptic seizures. This Kera Thailam versions would be better in targeting the Pitta when, for example, Nalpa Maradi Taila versus Keram. So Keram is coconut oil base. Is coolant and Pitta targeting agent better?
See, what I have observed in our classical text, something which is targeting to the skin. We have preferred coconut oil based materials. When it is typically for the Vata reduction, Acharyas have given weightage on Taila, but it particularly from the Tila Taila. The base would be Tila Taila. When the conditions which is suitable only for the skin purposes, something which is targeted to the dermal tissue, then it is Kera is used.
That makes so much sense because uh, coconut oil being cold would not penetrate deep, whereas sesame oil being Ushna and Snigdha penetrates deep.
I have a patient. He had a meniscus tear on the right knee, and he had an operation to remove the tear out of the knee. And after the operation, it was a successful operation. The knee has become a bit stiff, and obviously after walking for longer time, say let's say 20 minutes, 30 minutes, the knee gets more pain or get the pain. And somewhat if he walks more, then the knee sometimes gets swollen also. And obviously the left knee is fine. It basically has no issues. It bends up to the way we do the all the exercise or the yoga, but the right knee you can't even bend up to the Vajrasana. So my question is, what should he or what should we treat to the stiffness go away and the pain go away forever? And do we have any treatment to regrow the tissue, especially the meniscus tear?
Definitely, we can use certain medicines, oils in these conditions. But one thing we need to understand, natural is natural, and once operated place is operated place. Even though after very proper healing also, it is operated site. It will lose its natural capacity of expansion of the tissues, or it may be having a little bit of stiffness, some irritation, or artificial bonding of tissues will be there, something like that. So it will not be totally 100% natural. So with that, we need to keep it in mind. So a patient who has subjected for meniscus tear and operated, don't expect that he will go for once again doing Vajrasana and all those things. That type of issues are very extreme, and that should not be done. You may be instead of supporting it, may be even going for a damaging things. Only a mild type of activities till the tissue heals, comes totally, that needs to be done. Point number one. Second thing, two important oils and gritas are there in this condition. As it is something which is very close to Astidhatu, I suggest internal consumption of Gandha Taila as well as Panchatikta Gulu Gruta. This Panchatikta Gulu Gruta is very clearly, or Tiktaka Gruta, very clearly indicated in these type of Astikshaya, Astimajjagata diseases and these conditions. And Gandha Taila is very popular and very known and very effective in case of osteoarthritis and where there is something like erosions and such type of things. So definitely for this meniscal tear, we can try these things in the form of Dhara and Pichu or something like that, or even the Janubasti type of things which can be done. But still, totally regrowing the meniscus may not be possible.
I mean, for relieving pain and also to improve flexibility, Lucky to be useful, sir, or Yogaraj Gugulu to relieve stiffness?
No, that is another part of it. That is the internal medications. When we talk about only what about the any oils, Grita is very suitable for this condition. I suggested only the Panchatikta Gulu Grita and Gandha Taila. Along with that, when you want to give something, even Kashaya, then you can go for the Vatara Kashaya or even Maharasnadi Kashaya, something like that, or even the Sahacharadi Kashaya or Rasna Kashaya, something like that. You can be even going for that, even tablet in the form of Shallaki with Haridra, Shunti combinations, such type of things can be used.
Gritam is available as a capsule, as GT capsule. Have you used it, sir?
Yes, I come to know that, even I have used also. But very clearly, Gugulu Kashaya is also a combination which is actually explained in the Gruta format. The same Kalkadravyas are taken and Kashaya has been prepared. So Gugurtitya Grita is the original combination what Acharyas have very clearly mentioned. And this Grita is very, very bitter in nature. That's why that palatability is a very big issue. So people have come out with the capsulations. So there are available soft gelatin capsules containing Grita containing same thing, and even little bit modification. Some branding is also done, like in Pentacare, that Pro Skin capsule is there. That is an hard gelatin capsule with band sealed techniques. That also contains basically Panchatikta Gulugrita with certain modifications. So there are plenty of such things available in the market. And of course, if it is the same Grita is being put into that, there will be no issue. The consuming that. That will be easier also for the patient. And even Panchatikta Grita Guggulu is also available, but it is usually used in many conditions, many a times in skin related issues rather than this type of tear and all those things. Directly using a Grita, Panchatikta Gulugrita or Mahatikta Grita and Gandha Taila internally will be sufficient for the regrowth or the something like with osteoarthritis condition, or where there is tissue wear and tear and even erosion, such a type of things, that will be beneficial.
So, like how many of the orally indicated oils are getting converted into capsules, probably a range of grutas will also be converted into capsules in coming days. I think it's a good step in the right direction. So,
I think that's what I've said. One company called Sahasa Yogam from Hyderabad, they have done it already. There are almost 20 varieties or something like that. It is there. You just check it up. We'll find out. Sahasa Yogam, company name. They have come with soft gelatin capsules, 7 avarti, 14 avarti, 10 avarti, something like that. So many combinations. Sacharati is there. All grutas are there.
Yeah, in the injury, I think Ashish Ji was mentioning the injury related mobility and other conditions. Murivenna with Pinda Taila. So both this combination can be used for a Dara or Pichu. So that can be, I'm not speaking about internal medication. If internal and external can be considered, apart from the Bhagna Chikitsa or whatever it is there, so we can also think in the lines of Vata Rakta Chikitsa in this particular. So because in Vata Rakta etiological factors, injury is also one of the conditions which can aggravate both Vata and Rakta, which can cause immobility in the joints or less mobility in the joints. Vata Rakta line of treatment, again coming to that, we have Pinda Taila, the best one, the bridge for Vata and Pitta conditions, and Murivenna. When we combine that and do the Dhara, I have done in few conditions and I have got good results. So Dhara with the mixture of Pinda Taila and Murivenna or Pichu continuously. So initially, for initial days can help. So it depends on the extent of injury again. Again, as Sir said, regenerating the meniscus or tissue, it is a distant possibility, and doing vigorous activity also should be, the activity should be in control. So again, that also worsens the Vata and the Rakta in that condition. Vata Rakta line of treatment. So Lakshadi Gugulu can be a preference on one side. On another side, Kaishara Gugulu will be the ultimate option. Many conditions where injury prone mobility I have seen. I have just given Murivenna, Pinda Taila and Kaishara Gugulu as the single options, mild to moderate injuries. Definitely, so there will be substantial relief in those conditions. We can think on the lines of Vata.
Just to start with 2 oils or 3 oils, what should be the best way to take it forward? Just 2 or 3.
See, when we design a protocol for a treatment, it is not in that way that let me start with only 2 medicines or 3 medicines. You cannot restrict yourself in that fashion. The ultimate aim is to bring the relief to the patient. So with respect to that angle, and try to analyze the doshic involvement and pathology behind that, then try to break those pathologies. Samprapti Vigatnameva Chikitsa, then try to do it whatever it is. So in this case of any meniscal tear are already operated and is in recovery phase, and there is a restriction in these things, the internal medication option in the form of Grita and oil, which is a must for this condition, is Panchatikta Gulugrita and Gandha Taila. That's what I said. And what Dr. Raghuram sir has said very clearly, external application in the form of Kati Basti, Janu Basti or something like that, or Dhara, we can use Pinda Taila and Murivenna. That is a very bad thing. And along with that internal medication, if you want to give it, but definitely you can add on. Lakshadi Gugulu is there for your option, you can take it. Or even Shallaki is there, or you can make your own combination of these single ingredients and make it in the form of a Ganavati or something like that, you can give it. Or even form of a Churna, you can give it. Vata, Churna, something like that, make it with these combinations, you can give it. No issues. Even Ashwagandha, Bala combining things can be used. But internal 2 oils and externally this dhara and these things is a must for these conditions. Otherwise, simply I start with one or two, then you may land up in that there is no result, there is no hope in Ayurveda, and there is no hope for these conditions that will come.
Patient with meniscus tear in knee can sit comfortably in Vajrasana with a bolster under the buttocks. Yeah, here in this case, surgery is also done and might or might not work in all cases. We cannot like forcefully flex it to check.
We cannot force the any joint which is injured to take it in a very flexed way, which is what happens in previously. That cannot be.
No, sir. When we say a combination of oils, do we mix them together or apply separately at the same location? And when the combination of oil is used, probably a mild water-bed heat would be good for good for gelling the both oils together.
Combine them and passively warm them and just apply as a dara or basti. So stanika basti, local cooling. So that both can be done. So, Murivenna and Pindatela gel very well. So even in combination, they gel very well. So and the combined effect will be individually also they can be used. Like we can use Pindatela separately or Murivenna separately. But the combination I have seen, I have done in so many cases and it gives outstanding results. The combo effect is much better than the single things used.
The question is like how Dashamoola Taila stacks up against all those other oils. So it contains Dashamoola, then ginger, nirgundi, pipili mula, chavichitraka, shunti, maricha, krikatu, jiraka, krishna jiraka, sarshapa, yavakshara, Regrowth, haridra, daru haridra.
Once again, there are plenty of oils are there in Ayurveda. When it is not any peculiarly specially used oil, this Dashamoola oil also, once again, depending upon the, as Raghuram sir said, the pen habit of a doctor, that where he has got results, definitely following those things. And definitely Dashamoola is one of the best Vata Taila, so it can be. When Dashamoola, Balashugandha Taila, all these are almost in the same level they will be.
Back to like Raghuram sir's point, like practice, like
yeah. So regarding that meniscus tear and other things, the injury related healing I was speaking, since we spoke about Dashamoola, suddenly I thought of another formula which I always used in my clinical practice, Kshiradhara for such conditions. One is Tailadhara and another is Kshiradhara, the best in Vata Rakta Chikitsa, Kshirabastis and also the Kshiradharas. So Kshira, milk processed with Dashamoola and Laksha. Dashamoola and Laksha may be done in a Portly method. So like Dashamoola and Laksha tied in a bolus and dipped in milk, and it is prepared in the Kshirapaka Vidhi itself. Reduce it to half or 1/4, and that milk shall be used for external. So these things can be done. Tailadhara followed by Kshiradhara. So that also adds to the effect. Dashamoola and Laksha Siddha Kshira gives wonderful results in these conditions, wherever we think in the lines of Vata Rakta. The injury conditions thought in the line of Vata Rakta.
Why are you talking about Vata Rakta with meniscal tear? I was imagining.
No, meniscal tear, I have kept it apart. So I'm telling about this is a post-surgical thing what Ashish ji was telling. So like the surgery has happened and later now the problem has come with walking. So surgery for what? Meniscal tear, for an injury. Okay. So after that there may be, the injury is one of the causes. Injury is one of the causes for Vata aggravation and also Rakta aggravation.
Yeah.
Abhigata. So the trauma is, so post-surgery, now because the mobility is hampered, so the Vata and Rakta may be involved. In this stage, we can think on the lines of Vata Rakta Chikitsa. I'm not telling meniscal tear is Vata Rakta, but on the lines of Vata Rakta, we can tear. One more component I want to add is in such conditions, there will be enormous stress. So because there will be a subconscious fear to walk. Surgery is successful, but the patient is subconsciously having a fear to walk. What if I walk? I may aggravate my injury. So the patient should be counseled. That is another part. And the Sattva Vajaya Chikitsa is very, very important. And some medicines like Ashwagandha to relax the mind. So these things also, the mind approach also should be there. And the fear, so the patient should operate himself in a courageous way. The courage factor should be brought in. I always tell my patients, if your knee pain is in the knee, I can heal you. If your knee pain is in your head, we cannot heal that. Okay, so don't keep the pain in your head. So let the pain be wherever it is there. and that needs to be handled there itself. The local healing should take place. If it goes over to the head, it becomes very difficult. It becomes a stress factor, and a permanent file of that pain will be saved in the subconscious level, and it is very difficult to remove. So that becomes bhayajanya. Again there is vata aggravation itself.
Any joint injury or like post-operation of any joint injury can be treated in lines of water. That means very big.
Definitely, I would like to add to that. In the early phases of injury-ridden joints or something like that, when surgery has taken place or not even surgery done, in those patients in the beginning, what I suggested that Panchatikta Gulugruta and Gandhathaila internally that continues. Once we feel comfortably, there is a good thing, then we need to give strength to the joint. Then I prefer to shift over to Ashwagandha Grita. Ashwagandha Grita definitely gives good result in that continuation. And moreover, for what as Raghuram sir has said, for external dhara and this thing, Pindathaila and combination of Murivenna, definitely we need to think of another option is Mahamasha. Definitely it improves the strength and the tissue damages, repair and everything will be done very beautifully with that.
Yeah, very beautiful inclusions there, sir. So I mean, I just have my own question, like in the wherever the tissue regrowth is required, tissue regeneration is required, like senile osteoarthritis, etc. Does Basti play a role, or just oral administration is good enough that Basti may or may not be required?
Basti is of course the first choice. So Basti is the first choice. Need to be. In degenerative conditions, external and internal. Already I was pointing about this. Degeneration is a progressive condition. Okay, so we may or may not halt it. External therapies will ease the symptoms, and internal therapies like the Basti and other conditions will definitely combat Vayu at its Moolasthana. So considering the Ayurvedic basics, Basti is a must, and we have also found outstanding results with Basti. Whenever Basti comes into the picture, that is why it is Ardha Chikitsa. So that is why half of all the treatments in the world, definitely Basti should be included in degenerative condition. Oral, external and Basti. Again, one point to add before I finish, Gururaja sir mentioned one beautiful medicine, Mahamasha Taila or Brotmasha Taila. That was our Ishwari sir's favorite medicine for Kati Basti. He did not think about anything. Either it was Mahamasha Taila or it was to strengthen the conditions. Ashwagandha Balalaksha Taila. Another one. The next one was this one. Which one? Dhanwantaram. So that he used to use. Not Dhanwantaram, Mahanarayana Taila also he used to use. Dhanwantaram was very less used, as I said during the course of my undergraduation. I have hardly seen our physicians or teachers using Dhanwantaram Taila. Mahanarayana Taila was extensively used. Kshirabala was extensively used. Mahamasha Taila in Ballari was very, very popular. Extensively used Mahamasha Taila for low back conditions, even for Abhyanga and Kati Basti. It was available like anything. So once Kati Basti is written, it was very clear that we need to use Mahamasha Taila. Even the masseurs and the therapists used to be ready. So there was so much of stock of Mahamasha Taila there.
Particularly regarding that Mahamasha Taila, in recent days, I am just experimenting with many of my conditions, patients, where there is a severe pain associated with Kati Vata, and they are telling that they cannot move. While coming to the OPD itself, they will be limping. And such type of patients, when we go with the Mahamasha Taila, very second sitting, they will be walking straight. And that is one of the beauty of this Mahamasha Taila. And of course, we have done peculiarly for my personal usage. I requested my company to produce, and they have done it very meticulously. And it is a Samisha Masha Taila, Mahamasha Taila. It is having even the Mamsayane. That is very typically it is useful, and definitely such type of combinations if available, then definitely the physician and the clinician will have plenty of weapons to play with.
Probably with the non-visual ingredient, the oil's shelf life would decrease a little.
No, as such it will be not that, but efficacy wise when it comes, see, I am very much clear with that. When I need result, when there is result, I can use anything. That's what my comment is. Whatever Ayurveda has said, I will try it, but when there is, it should give me result. If it is result is there, then I will catch hold of that and continue to use that. That's a simple method.
How long can we give the capsules? As long as the symptoms persist and as long as the regeneration, pain, etc., are there, so long. And most of these, whatever we have discussed, are very safe for even long-term use also. What is the proportion of oils when two oils are mixed? What is the right proportion to use? 50-50 in most cases, and it also depends on where we are concentrating more.
So it is not always we should go with a 50-50, because when we are combining oils like Murivenna, Taila, then there will be no problem. We can go with a 50-50. When you are combining Dhanwantaram or Taila, these things, nothing will be, no issues. But many a times we use Gururaja Taila is more penetrative. You cannot have a 50-50% of Gururaja Taila. See, in that condition, many a times I make 200 ml of Taila, 200 ml of Dhanwantaram Taila, 100 ml of Gururaja Taila. So such type of combinations also need to be addressed. Otherwise, patient will have a burning sensation later after the process. There will be counter irritation in the locally where we are used it. So that needs to be kept in mind and things to be done in accordingly.
See you in the next Gurubodha session.
Thank you.
Thank you everyone.